What if the very medical screenings you trust to keep you healthy could actually be putting your life at risk? This uncomfortable reality affects millions of older adults who unknowingly undergo testing that creates more problems than solutions. Recent research indicates that nearly 4 out of 10 medical screenings performed on seniors result in unwarranted treatments, dangerous complications, or lasting health consequences. Shockingly, the vast majority of people over 70 remain completely unaware they're being overtested. One particular screening we'll discuss actually contributes to 5% of all cancer diagnoses in America, matching the cancer risk of daily alcohol consumption. Medical facilities won't advertise this alarming statistic, and you won't find it prominently displayed anywhere. Yet the scientific evidence is undeniable. Today we're exposing the 5 medical screenings that can cause serious harm to seniors, revealing the disturbing facts healthcare providers rarely share. The research backing these findings will surprise you, especially what earned the number 2 spot on our list. Drop a comment sharing your location, age, and whether you've experienced regret over any medical test or procedure. Do you believe seniors undergo excessive testing? We personally respond to every comment with tailored guidance and suggestions. Please show your support by liking this video and subscribing for similar content. Let's examine the first screening. Seemingly innocent, but capable of quietly devastating your well-being. 5. Bone density testing. This appears completely benign. A swift, painless scan requiring no injections that determines your fracture risk. However, here's the untold story. For individuals over 70, bone density screenings frequently generate unnecessary anxiety rather than genuine benefits. DEXA scanning measures bone strength and primarily detects osteoporosis. Yet in older patients, particularly women, results consistently indicate reduced density even without actual danger. Natural bone loss accompanies aging just like wrinkles or graying hair. It's universal. Despite this, countless seniors receive pressure to take bisphosphonate medications, supposedly strengthening bones, yet carrying severe complications including jawbone death, osteonecrosis, and throat irritation. The core issue? Research demonstrates that treating mild bone loss in adults over 70 with medication produces minimal impact on actual fracture prevention. A Journal of the American Geriatric Society study tracking 200+ women over 70 found bisphosphonates decreased fracture risk by merely 0.3% over 5 years. While not insignificant, this hardly represents life-saving intervention. Meanwhile, these women faced substantially higher risks of medication complications, including digestive problems, throat inflammation, and unusual bone breaks. Consider Margaret, a 76-year-old former piano instructor sent for DEXA testing during routine examination. She'd never fallen, experienced no pain, and walked regularly. Her scan revealed osteopenia, mild bone density reduction that doesn't qualify as osteoporosis. Her physician immediately prescribed alendronate. 3 months later, she developed severe acid reflux and jaw discomfort. When we evaluated her, she hadn't touched piano keys in weeks. We discontinued the medication, implementing vitamin D supplementation, resistance exercise using bands, and calcium-rich nutrition featuring sardines and leafy vegetables. 12 months later, she returned to performing recitals with improved leg strength, enhanced balance, and 0 fractures. Bone density screening might seem prudent, but for adults over 70 without falls or fractures, lifestyle modifications prove superior. Strength conditioning, balance training, proper nutrition, and addressing vitamin D deficiency reduce fractures by over 20%, according to 2022 Osteoporosis International Research. Don't allow screen numbers to frighten you into potentially unnecessary treatment. However, one scan can lead to something far more terrifying: brain surgery. 4. Brain MRI for memory concerns. When seniors notice increased forgetfulness or confusion, fear naturally emerges, fear of dementia and Alzheimer's. Consequently, physicians often order brain MRIs. But here's the uncomfortable reality. MRIs providing detailed brain structural images rarely deliver the answers patients seek. Most MRIs in people over 70 simply reveal age-related changes, minor shrinkage or white matter spots completely normal in older adults. Yet once detected, these findings can trigger cascading fear, additional testing, and even surgery that may worsen rather than improve memory. A 2021 Neurology Today study, reviewing 3,000+ MRI scans in patients aged 70 to 85 with mild cognitive complaints, found 86% showed some brain abnormality, but only 3% linked to actually treatable conditions. This means 97% endured emotional distress hearing something's wrong when nothing truly was. Worse, nearly 12% underwent invasive procedures like spinal taps or exploratory biopsies based on ambiguous scan findings. Consider Harold, a 74-year-old retired engineer concerned about forgetfulness. Though mentally sharp, he misplaced keys more frequently and occasionally forgot names. His physician ordered an MRI revealing white matter changes. Harold panicked, convinced he had dementia. He stopped driving and attending church. His anxiety escalated over subsequent months. However, when we reassessed him using standard cognitive testing, his performance fell well within normal ranges. We explained his MRI findings were age-appropriate and helped him focus on lifestyle interventions, including sleep optimization, hydration, and cognitive exercises. Within 3 months, his memory stabilized and he felt himself again. Unless severe neurological symptoms exist, seizures, sudden personality changes, or rapid functional decline, MRIs rarely help with mild memory loss. Better initial steps include cognitive screening tests, simple paper-based evaluations assessing memory, attention, and problem-solving. These are affordable, effective, and avoid unnecessary panic risks. Prepare yourself, because our next screening is one you've likely undergone repeatedly, and it's number 3 for good reason. 3. Cardiac stress testing. This ranks among the most common tests given to seniors reporting mild fatigue, chest tightness, or simply feeling different than usual. Cardiac stress testing monitors your heart during treadmill exercise or medications simulating physical activity to identify blocked arteries. However, after 70, this test frequently causes more harm than benefit, particularly when used on individuals without clear heart disease indicators. It can trigger false alarms and unnecessary cardiac procedures, carrying serious risks. The accuracy problem is significant. Studies show false positive rates for stress tests in adults over 70, indicating problems where none exist can reach 40%. This leads to follow-up testing like angiograms and even unnecessary stent placement or bypass surgery. A major 2017 JAMA cardiology study found over half of all stents placed following stress test referrals occurred in patients lacking real symptoms or benefit. These patients showed no survival or quality of life improvement post-procedure. However, they experienced higher rates of bleeding, kidney injury from contrast materials, and extended hospitalizations. This affected Robert, a 75-year-old retired mail carrier staying active through daily walks. During checkup, he mentioned occasional fatigue on hills. His doctor scheduled stress testing just to be safe. Unclear results led to catheterization, inserting tubes into arteries checking for blockages. Mild narrowing was discovered and a stent placed. That evening, Robert reacted to contrast dye and developed kidney complications. He spent 6 days hospitalized, requiring weeks of follow-up care. The fatigue remained unchanged because it wasn't cardiac-related. He simply needed better hydration and more rest between activities. If you're over 70 without classic cardiac symptoms, chest pain during activity, exercise-induced shortness of breath, or significant energy drops during light exercise, stress testing may cause more harm than good. Better options often include resting EKGs, examining heart rhythm at rest, or coronary calcium scans using low radiation imaging to detect dangerous plaque buildup. These are safer, simpler, and far less likely to push you toward unnecessary procedures. 2. Colonoscopy screening. You probably didn't anticipate this one, but colonoscopies, procedures using long cameras to examine your colon, aren't always wise choices after 70 and are rarely recommended past 75 unless specific symptoms exist. Age increases risks. Preparation involves harsh laxatives causing dehydration, dizziness, or kidney problems. Sedation used during procedures poses additional brain function risks in older adults. Most surprisingly, the test itself can cause complications, including bleeding, tearing, or heart rhythm disturbances during sedation. A 2019 JAMA internal medicine study following 1.3+ million Medicare patients aged 70+ found that per 1,000 colonoscopies performed in patients over 75, only 2 lives were saved, while over 20 people experienced serious complications. That's a 10-1-1 risk-to-benefit ratio. Even when polyps are found, many are small and slow-growing. Removing them in older adults sometimes causes more harm than leaving them alone. Consider Linda, a 73-year-old grandmother running a small bakery with her daughter. She had no symptoms, bleeding, stool changes, or family colon cancer history. Her new primary physician, recently completing residency, urged screening colonoscopy. She agreed. During the procedure, a small polyp was removed and she went home. That night, she experienced severe abdominal pain and fainted. Hospital evaluation revealed bowel perforation. She spent 9 days recovering, lost 10 pounds, and hasn't been the same since. Reviewing her case, we discovered she'd already had 2 clear colonoscopies previously. There was no reason for repetition. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, stool-based testing like FIT tests, non-invasive fecal testing done at home, often proves safer. It requires no preparation or sedation while still detecting most concerning cases. Ask your physician about alternatives, because once you enter the colonoscopy pipeline, it's difficult to exit. Now we've reached the most overused, dangerous, and harmful screening for seniors, one you've almost certainly undergone. 1. Annual full-body CT scans. Full-body CT scans, sometimes offered through executive health packages or preventive services at private clinics, are marketed for early cancer detection. Here's the shocking truth. These scans expose your body to high ionizing radiation doses. For older adults, especially over 70, the risk of triggering unnecessary follow-ups, biopsies, and surgeries is extremely high. The irony? Zero evidence exists that full-body scans without symptoms save lives. Each scan delivers 10-20 millisieverts of radiation, equivalent to roughly 500 chest X-rays. According to a 2023 modeling study in JAMA Internal Medicine, rising CT scan usage across America may now account for up to 5% of all cancers, rivaling alcohol as a cancer-causing factor. This means 1 in 20 cancers could result from scans intended to prevent disease. That's not just counterproductive, it's terrifying. Scans can detect harmless nodules, calcifications, or cysts that are simply aging components. But once seen, red flags emerge. More scans follow, then biopsies, then panic. Consider William, an active 80-year-old who taught martial arts to younger seniors. Feeling great, he participated in an elite senior checkup at a private clinic. His full-body scan revealed a tiny 3mm lung nodule triggering a chain reaction. He was referred to oncology, sent for PT scanning, and eventually underwent needle biopsy. The result? Benign. But the biopsy collapsed part of his lung, leading to hospitalization and 2-month recovery, all for something that could have been monitored. Experts now advise that full-body CT scans should never be used for general screening in symptom-free adults. The American College of Radiology is clear. There's no proven benefit and significant harm potential. If symptoms exist, unexplained weight loss, coughing blood, or visible swelling, targeted imaging makes sense. But scanning the entire body without focus resembles searching for treasure with a landmine detector. You might find something, but the damage could exceed what you were trying to prevent. A safer, smarter approach involves listening to your body. If you feel well, maintain regular primary care checkups and only pursue clearly indicated testing. Your time, energy, and health are too valuable to waste on fear-driven screening, potentially leaving you worse than you started. A conclusion. There you have it. 5 screenings that seem helpful but can actually harm, especially past 70. Modern medicine is powerful but imperfect. Sometimes less truly is more. Always ask, what happens if this test finds something? If the answer is unclear, or if risks exceed rewards, it may be time to pause. Genuine prevention begins with lifestyle. Stay active, eat well, sleep deeply, and choose your screenings wisely. We want to hear from you. Have you or a loved one ever faced complications from medical testing or treatment that proved unnecessary? What occurred? Share your experiences and thoughts in the comments below. We'd love to hear them. Thanks for watching.